Hi gals, we're filming at the Getty Center this week, so stay tuned for our topic. Hi guys, so today we're going to talk about what to do to improve any urinary incontinence or any urine leaking that you may have. So I was just at the American College of OBGYN meeting in DC, and I ran into the people who make these awesome products called Poise. They're basically disposable pessaries. So what this is some people have urinary leaking, or what we call stress incontinence. Some women, when they sneeze, cough, laugh too hard, can leak urine. And there's a few treatments that can be used for this, and one of them is to use a pessary, or a little device that kind of holds your bladder in its place so that you don't leak any urine. So it's very important to not use this product unless you absolutely need it. So of course you have to see your OBGYN or your urologist or your primary care doctor or someone to see if indeed you have urinary incontinence because of the way your bladder is positioned. So there's other reasons that you may have urinary incontinence or leaking. Some women can have an infection and that can cause leaking. There's other conditions like a fistula, or you can have maybe you have another problem like diabetes and then your bladder doesn't function well. So you have to make sure that your doctor tells you first that the reason why you're having urinary incontinence is because of the angle of your urethra and the way that your bladder is positioned. Okay, so if you do meet the criteria for stress urinary incontinence, this is a great product that you can use, and it's over the counter. It's called Poise Impressa, and they sell it in these sizing kits. This is what they say you should use first, because it comes with 3 different sizes, 1, 2, and 3, and you can first see what size is best for you, and then once you determine which one is your best size, you can just go back and buy the correct size for you, and they sell them in 10, I think they come 10 in a pack. And this also comes with a $4 coupon for your next purchase. And then you can try out the first size, and if it's comfortable and you don't have any leaks, then that's your right size. If you're still having leaks, then try size number 2. And if you're comfortable and not having any leaks, then that's your correct size. If you continue to have leaks or you're uncomfortable, then go ahead and try size number 3. If there aren't any leaks and it feels comfortable, then you're size 3. So this is what the product actually looks like, and it comes in here like it comes in an applicator, like just like a tampon. So it comes in here, and it will come out through here, and then insert this in the vagina like a tampon. And check out my video on how to insert the Diva cup or the tampons, and it'll show you how to insert this. And then this will come out, and this is what stays in the vagina. You can use it up to 8 hours, and then to remove it, you just pull it out and see how the shape of it. So it's this nice square, and when you pull it, it'll become more narrow, so it'll fit easily. So size 1 is like the smallest size, size 2 is this size, and then size 3 is the same size as size 2, but it is more rigid. So there's some situations where you definitely shouldn't use this Impressa pessary bladder support. So it says if you are under the age of 21, don't use this. If you're pregnant, or maybe become pregnant or have given birth within the last 3 months, have unusual and unexpected vaginal bleeding within the last 6 months, so unexplained vaginal bleeding, have pain or burning when you urinate. That's what we said, that it might be an infection while you're leaking, so please make sure you don't have an infection. Are you experiencing vaginal discharge that smells bad, irritation, soreness, or itching? Also, it could be a vaginal infection that's causing the leaking, so don't go and use this. Please make sure you don't have an infection first. Had vaginal surgery within the last 3 months, like given birth, or if you had some sort of surgery on in your vagina, have already been diagnosed by your doctor with a severely dry atrophic vagina. So I hope this was helpful. Make sure you like the video and subscribe to the channel. Like us on Facebook, and now we're on Twitter. I'm gonna add some new different videos, short clips to the Facebook page, so make sure you check that out, and I'll see you next week.